Good afternoon, everybody. Welcome to this third webinar in our series on young adult health. My name is Lynn Brettel. I'm the director of the State Adolescent Health Resource Center at the University of Minnesota. Today's webinar is sponsored by the Adolescent and Young Adult Health National Resource Center, of which SARC is a partner. We're really happy you could all join us today and make the time to have this important conversation about the health of young adult males. And we're really happy to have two excellent presenters with us today who are willing to share their time and expertise, Dr. Noah Weatherton and also Dr. Gabriela Vargas. I'll introduce them in just a moment. Wanted to give you a little bit of a background on our webinar series and what brings us to our webinar today. One of the 5 overarching goals of our National Resource Center is to advance the health of young adults by increasing the number of states that address a Title V young adult focused performance or outcome measure. So to that end, we developed this webinar series as a way to engage our primary audience, who are Title V adolescent health coordinators in the states around the country and 9 territories, and also other Title V MCH staff. We wanted to provide them with resources and guidance that might encourage the adoption and implementation of a young adult focused national performance measure. We know that based on registrations and the number of attendees today on this webinar, that there are quite a few of you who are not specifically adolescent health coordinators or working in state level public health. And we're really happy to have all of you joining us today. Just wanted to give you a little background of the audience of who the speakers may have been targeting. Some of our presentation focus that will be focusing on some of the unique needs of young adult males in healthcare, as well as some of the strategies that we can use on a public health level and addressing those needs. So with that, I'm going to turn it over to our presenters. Dr. Noah Weatherton is a psychiatric mental health nurse practitioner at Valley Cities Behavioral Health in Seattle, and we're thrilled that he is with us today. He's going to be presenting first, and then Dr. Gabriela Vargas, who is an attending physician in the Division of Adolescent and Young Adult Medicine at Boston Children's Hospital, is with us as well, and she will be presenting after Dr. Weatherton. So Noah and Gabriela, thank you so much for joining us today. We're really grateful for your time and expertise, and I will turn it over to you, Noah.
All right, let me share my screen and we will get started. Well, thank you, Lynn, and thanks for everybody for being here today. I'm excited to talk about the issue of young adult male mental health because I believe that young men are complex and nuanced, and they have unfortunately been cheated out of their complexity by our society as full humans in many ways. My goal today is to bring into focus the diversity of young men and the staggering health risks that need addressing. So here's what you can expect from our talk today. We will start by describing the characteristics of adolescent and young adult males. Then we will talk about the man box as a way to frame traditional masculinity. I'll touch briefly on the current mental health data and outcomes, as well as strategies and examples for improving young men's health. Then Dr. Vargas will review health and healthcare engagement. And lastly, we'll have a more open discussion around COVID-19 and the need for creating connection in the new normal that we're all in. Okay, before we get started, I just want to say that there's going to be a lot of memes in this talk. I want to highlight this off the bat because I think that they're useful for communicating complex ideas and are an important way that youth communicate information. So first, who are we talking about? For this presentation, we'll be focusing on all boys and young men from ages 12 to 25. I'm going to dive into the context of this demographic because I think it's important to consider the impact of the crises that they've experienced and the technology that is comfortable for them. This context will not only help frame their mental health, but will ultimately inform the ways that each group may be seeking health information. So let's start with the 25-year-olds. They were 6 during 9/11 entered adolescence in 2008 during the financial recession. 18-year-olds were born post 9/11, started high school during the Trump administration, and they're finishing high school during the COVID crisis. And finally, the 12-year-olds, born during the 2008 financial crisis, and they're currently navigating their adolescence under lockdown. All of this while facing the increasing reality of climate change. As a cohort, the two unique generational characteristics I'd like you to keep in mind is one, their digital connectivity, and two, the acute crises that have defined their lives. And so, how are young men and their health uniquely impacted by these circumstances? I'm hoping you can keep that question in mind as we move through today's talk. So before we go any further, I want to ask, what words do you all think of that describe young men in these age groups? We'll give you all a minute to jump in the chat box and add to the discussion. So I'm seeing addicted to technology, bold, courageous, curious, loud, active, yeah. Scared, yeah. Unmotivated, silly, dreamers, angry, irritated. Yeah. So all of those, many of those answers, immature, we're getting a lot of answers. Creative and smart, power, confused. And we'll add all of these to the PowerPoint presentation at the end. Thank you all for your input. And many of these answers might be impacted by something we call the man box. And this last one from Roberta, wanting to be understood. And I think that's really key. Thank you, Roberta. So we can't get very far in talking about young men without talking about masculinity. I want to introduce unhealthy, quote unquote, restrictive masculinity through the concept of the man box. When we look at the literature, we see that a greater presence of these restrictive masculinity characteristics are linked to worse health outcomes due to things like self-stigma and lack of help-seeking attitudes. Dr. Vargas will talk more about this a bit later on today, but for now, we'll talk about some of the crises that stem from these restrictive behaviors. 1, restricted emotional expression, 2, body image and nutrition, and 3, the crisis of connection. And just give me a minute here. So let's take a moment to talk about young men and friendships. Dr. Niobe Way, who is a leading voice on the subject, has laid out the ways in which the mainstream man box culture drives boys towards loneliness. Prior to adolescence, boys tend to have multiple friends they care about and trust in. And as time goes on, they often get stuck in the man box. For example, a boy may struggle in confronting a conflict with his close friend. Because neither have been given the emotional tools to express themselves, they are alienated from each other and slowly drift apart. Dr. Way talks about how this slow drift defines the experience of adolescence, priming adolescent and young adult males for further alienation from other men. And this ultimately creates an emotional dependence on partners and a crisis of connection. As pointed out recently by former Surgeon General Vivek Murthy, loneliness has serious negative health impacts on par with smoking nearly a pack of cigarettes a day. When we talk about emotional expression in young men, there are some specific points to keep in mind when working with them in a clinical setting. So we know from the man box that stoicism is a huge component of what boys think it means to be a man. On the ground, this means that they aren't going to be coming into the clinic as much, let alone that they will be open about their need for help. The literature tells us, and we know this as well, that boys aren't given the permission to express their emotions fully. This limited range in boys may look like being too cool to care, or irritable, or just tired. As clinicians, that doesn't leave us much to work with. And if a young man is feeling depressed or anxious, this may not present in the ways we generally understand. In depression, for example, this looks more like externalizing behaviors like irritability, aggression, and increased risky behaviors. So as clinicians, we have to reorient how we are reaching out to young men and also change our lens on how their emotional expression may be reflecting their internal struggles. I want to turn now to the topic of body image and nutrition. While this issue is less common than in young women, I believe it warrants attention as it's more common than many people think. For young men, body image issues are shown to go hand in hand with increased social media use, especially in the image-centric Instagram world. There's a specific type of body dysmorphia that is important to highlight, which is muscle dysmorphia or bigorexia. This leads men to turn toward dangerous methods like extreme dieting, supplements, and anabolic steroids to bulk up in order to fit an idealized body image. Disordered eating is also an issue that is important to talk about. We know that transgender and gay men, as well as men with obesity, are at greater risk for disordered eating. But there has been a recent trend of quote-unquote biohacking diets like intermittent fasting and keto that can easily slip into disordered eating. While there may be some nutritional benefits, many men find this appealing as it falls back into those man box ideals of a leaner, sexier, more disciplined you. And just as for women, there's a need for young men to have body positive messages front and center to counteract the prevailing unhealthy narratives. So one of the negative health impacts of loneliness that we talked about, one of them is of course suicide. It's the second leading cause of death for adolescents and young adults behind accidental death. And in the graphs, you see the gender disparities between young men and young women. On the y-axis, we're looking at deaths per 100,000, and on the x-axis, we're looking at the years 2002 to 2018. We can see how the gap between between men and women is growing. And it's also crucial to note that this is further exacerbated for transgender men and non-binary people assigned female at birth. For this population, community connections and access to gender-affirming care are major protective factors. And for a more in-depth talk, I recommend viewing last month's excellent webinar on suicide prevention. So we'll break out to the chat box again, asking you all, what are ways that you've connected with someone in the past month? Especially with a lot of us being isolated, I'd like to know what are just some ways that you found that are maybe a little bit different. And I think there's a lot of parallels with maybe how young men might feel isolated kind of in their regular day-to-day. So I'm seeing some input already. We're seeing video gaming with chat, telephone and Zoom, using Zoom and video chat, a lot of those, a lot more video chat programs. FaceTime. Oh, I like this one, watching movies virtually together. That's a really great one, great way to connect, stay connected. Stretching with your sisters, yeah. I like this new one, downloading House Party and playing games while chatting with friends. So that's a great way to stay connected. And then, of course, old school writing letters. A lot of good input here. Yeah, talking on the phone, just kind of the old school ways of doing that. House Party app or Marco Polo app. I'm not familiar with the Marco Polo one, but I imagine it's similar to House Party. Yeah, lots of really good. A lot of these are technology driven, and I think that's a really great way to kind of leverage all the tools and opportunities we have. And then Mary Green says she delivered flowers to close neighbors, which You can't get more connected than that. That's really sweet. Well, thank you all. And again, I'll put these all in the chat box for you all to look at again. And like a lot of you mentioned, a lot of this is using technology that we have at our fingertips in order to remain connected. And so I think that's something that young men are doing a lot of as well. Okay, I'm seeing my picture isn't coming up here, but no matter. I want to move on now to relational health. And before we discuss this concept, I think it's first important to step back and recognize the ways that we're commonly trained to think about adolescence. Erik Erikson's stage of development theory has cemented its place in the ways that we understand adolescence. He frames the main conflict of adolescence to be identity versus role confusion, and the central question to this struggle to be, who am I and what can I be? And while this search for identity may be true for adolescents, it doesn't seem to encompass the full complexity of what young people are grappling with. I think it's safe to say that identity and role confusion happens throughout the lifetime for many people, and that we don't have ourselves quote unquote figured out by our mid-20s. And so at Partnership for Male Youth, we have begun to examine how we can better serve young men through the lens of relational health, which is a model pioneered by Dr. Bell Liang at Boston College. And this model centers the hallmark of identity development isn't finding one's set place in the world, but rather gaining a sense of connection to others through growth fostering relationships. And this can mean relationships with friends, with mentors, with educators, or healthcare providers. And you can see the major growth fostering characteristics that are outlined here. But what's most important to take away is the necessity to see that young men aren't an island, and they need meaningful connection as a key part of their development. And the picture that's not coming up is just a really wonderful picture of these two men, Dustin and Roger, who had a great photo shoot together and are being physically close, kind of being able to have those growth fostering relationships. And on that note, here's a book I really love that highlights pictures of men in friendships together from pre-World War II. And I bring this up not only because it's sweet and rare to see nowadays, but to highlight that the culture of masculinity has a history of healthy connections, and that the man box is not essential to being a man. And so what can that look like now? We can move outside the restrictive masculinity man box towards what we can simply call healthy masculinity. As we step out of the man box, here are some basic examples I would put under the healthy masculinity subtext, but being things that promote health and social connection. And below, I've just put a few examples of men who show qualities of healthy masculinity. NBA player Kevin Love, who opened up a few years ago about having panic attacks before games. Lil Nas X, who is a hip hop artist that came out last year as openly gay at the height of his popularity. And lastly, Thomas Page McBee. He's a trans man and an author, and his book Amateur discusses the complexities of embodying masculinity within mostly male spaces like boxing gyms. Each of these men are great examples of telling another story of what being a man is. And in this next slide, I want to highlight the ways in which young men are finding connection now. As healthcare providers and adults, and within a rapidly changing social ecosystem, it can be really hard to know how young men are connecting, if at all. Young men are connecting in many unique ways online. And in all of this, I believe that they're seeking a sense of connection and community and wanting to feel seen for who they are. And of course, also for entertainment and distraction. In connections, there are ways that young men are finding meaningful social connection through social media like YouTube, Instagram, TikTok, and Discord. And for those who aren't familiar, Discord is an online chat platform that many young men will use to stay in connection with each other, sort of like an ongoing group chat and a more anonymous-based interest chat room rolled into one. And much of these platforms blend together into the online gaming world, whether that's over PC or Xbox or PlayStation 4. And these are unique social spaces where young men are not only connecting with friends in real life, but others that they've never met but have bonded with. And there can often be a core group of friends that plan times that will play and do this regularly. And I'm sure many of you have seen that. Within these spaces, there's strategizing, there's teamwork, and then there's, of course, the more lax kind of how is your day socializing. And this, of course, creates a sense of friendship, and many young men carry this connection with them over Discord messaging throughout their daily lives. So they're in constant contact with each other. Like YouTube, Twitch is an incredibly popular platform, and its main use is watching others play video games, sometimes competitively and sometimes not. And this too becomes an interactive community of sorts, and has risen in popularity in the last few years. And Twitch can also be used for any kind of live streams, whether that's political events or someone just in their own home. So on the insulation side, I've highlighted a couple ways, negative ways that drive young men to be less emotionally intelligent and more grievance-based and reactive in their emotions. The point I find interesting here is the ways in which the internet can act as a rabbit hole for young men who are seeking information or advice. So one younger friend I talked to told me how young men will search online because they have no one to ask. Some simple question like how to talk to girls. And unfortunately, the algorithms will be leveraged to steer these searches toward extreme content. So here we see an example where someone is seeking health or social information and it's being used for antisocial purposes, or that this young man will go down a content rabbit hole and come out the other side believing unhealthy or untrue ideas. And lastly, I just want to highlight that young men are finding connections on forums like 4chan and 8chan and Reddit. Like all of the other platforms, nothing is inherently dangerous about any of them, but rather it's how they're used as tools. So each of these forums are complex ecosystems that provide social support and information, as well as more unhealthy channels of information and connection. Because we want to understand young men better, I think it's important to ask not only how they're connecting, but who is shaping the cultural landscape and whose voices are many men listening to. For boys and younger teens, YouTube and Twitch streaming personalities are a big draw. To speak broadly, these channels make revenue through regular content, as well as going to more extreme lengths to attract more views and subscriptions. In addition to pushing boundaries, many make edgy or off-color or ironically racist comments and jokes, which in turn shapes the views of a young audience and primes them as they age for a more libertarian or anti-PC worldview. And on the other hand, aimed at an older audience, conservative and libertarian commentators have created another media landscape. These commentators often weave lifestyle brands, anti-PC cultural grievances, politics, philosophy, and conspiracy theories together in a casual interview and free-form dialogue, which gives men the feeling of hanging with the guys. Importantly, there's commonly a doubling down of the restrictive masculinity and man box ideas. And while there of course aren't hard cutoffs on who is viewing this media, their popularity cannot be understated. So I have the number of subscribers there for a lot of the streaming and YouTube personalities. And for example, the Joe Rogan Experience had 190 million downloads in 1 month at this time last year. So while we need to recognize and understand the voices and ideas that are out there, I think it's just as important for us as adolescent and public health workers to ask, how do we fit into this landscape? And how can our messages be more effectively heard? So here's an example of health promotion messaging through the use of restrictive masculinity. And you can see that while it may have some short-term appeal for its shock value, it's clearly problematic and doesn't change how men view themselves or their health. As healthcare providers, we know that we need to improve engagement in online spaces. We know that young men are spending a lot of time online and searching for health information, but it's not enough to just put messaging out there. We need to make it accessible for young men who we know have a poor online health literacy. Health literacy is a social determinant of health, and research shows that up to 60% of adolescents and young adults have poor health literacy, with a significant amount indiscriminately choosing search results that pop up when asking a health question. And so how do we fill the gaps? First and foremost, it's important to reframe social media as a health engagement and health literacy tool, not just as a time waster. Secondly, we need to provide resources for young men and their adults that are easily accessible. And lastly, our messaging has to be positive, it has to be easily digestible, and it has to be gender transformative. When I say easily digestible, these messages need to be like a snack. When you see a teen scrolling through Instagram, they aren't thinking very hard. They may look at an image for 2 seconds tops. And our health messages need to be nutritious snacks for their brain that counteract the more unhealthy messages they're seeing everywhere else. And so here are a couple of examples of what we're talking about that use positive masculinity messaging. I just want to note that the one on the right comes from a young man, and that this is an example of a young person creating healthy messaging to express what he needs. We need to center young men's voices and creativity when developing our health promotion messages. And here are some more examples of health promotion messaging through social media. The one on the left is a University of Minnesota doctor using TikTok, and the Instagram page on the right is one that I run and work on that's focused on young men's health. And here are a few programming examples to know about. I'll just highlight a few that stand out to me as far as innovative models. Next Gen Men is a nonprofit in Canada that does extracurricular programming with young men, focusing on changing the narrative early on. So prior to high school, even prior to middle school, we can begin talking about this topic. Coaching Boys into Men is a model used nationwide here, where high school coaches are trained on issues of consent and sexual violence prevention and domestic violence. Coaches then incorporate those messages into their time with athletes after sports practices. And this has been shown to have a huge impact on reducing rates of sexual violence. And with that, I will turn it over now to Dr. Gabby Vargas.
All right, thank you, Dr. Weatherton. I really appreciate that. I'm just going to share my screen. All right, so it's my pleasure to be here today with all of you, and I can speak for Dr. Weatherton and myself when I say that we are both so excited to have so many participants in today's webinar. Dr. Weatherton and I met at the Society of Adolescent Health annual conference, and since then we have both been co-leading the Male Health Special Interest Group, and so this is a passion for both of us. As Lynn mentioned earlier, my name is Gabriela Vargas, and I'm an adolescent young adult medicine physician at Boston Children's. As many of you, I wear many hats. One of my hats is around young adult male health and working with a young adult male health website that I'll talk about in a little bit, as well as working on transitions for young adults within our clinic. And so today I'm going to be talking about young adult males' health and healthcare engagement. The goals for my section of the talk are to just review framework for health and healthcare engagement, as well as to review the unique factors that affect young adult males with their health and healthcare engagement, and discuss public health considerations for engaging young adult males, as well as reviewing our online platform for young adult males. So to take a step back, I want us to just think about health and healthcare, and really take a perspective of a socio-ecological framework, which was first developed in the 1970s and really formalized during the 1980s. And I would invite everyone to participate into the chat as to what you think some societal factors are that affect young adults just generally and their health. Trauma, absolutely. Family engagement and support, environment, bullying, first-time finances, family closeness and acceptance, culture, media, drugs, absolutely. The other pieces from a societal standpoint too is what emphasis do we put on health or public health and policies that will support young adults' development, as Dr. Weatherton alluded to earlier. Also biases from healthcare providers and not respecting young people's ability to know what's best for themselves, and racism, absolutely, gender and sexual identity. Thank you so much for participating. The next piece is thinking about the community piece. And so I think many of you already alluded to this, and even just by the nature of this webinar, we are really focusing on the community of young adults and the unique factors that affect their engagement with their health and healthcare. And that also includes their sense perhaps of invincibility for many of them, where they're overall pretty healthy and so may not necessarily value health and healthcare quite as much as some of their older counterparts or younger counterparts. There's also the relationship piece. Again, many of you already alluded to this. Healthcare providers and interactions that our young adults have while they're children or in their younger adolescence can really shape what their relationship will be like once with healthcare, once they become older. And so it's really important that those relationships are healthy and hopefully free of bias and racism, where they can engage openly with their healthcare provider. And lastly, there's the individual piece. And so some young adults do have health concerns or chronic health problems, and it's important to take that into context. So we know from the socio-ecological framework, there's many levels affecting health and healthcare engagement. Now, with adolescent and young adult males, we know on top of all of that, there's restrictive masculinity and really the man box. And so I want you to just take a moment to feel free to put it in the chat or to just reflect yourself, to think about how these factors of self-sufficiency, acting tough, having control, and these rigid masculine gender roles can really impact males' engagement in healthcare and seeking help. We also know that this aspect of restrictive masculinity has many implications, as Noah, Dr. Weatherton alluded to earlier, with life satisfaction and self-confidence, mental health, higher rates of suicide than their young adult female counterparts, their relational health, their risky behaviors and engagement with substance use, and violence and trauma from that, as well as physical trauma. And so with all of this in mind, we also know that restrictive masculinity affects their actual healthcare engagement. Young adult males are less likely than their female counterparts to have a usual source of healthcare, to have visited a doctor in the past 12 months, and to have even gone to the emergency department in the past 12 months. And I really want to just take a moment to reiterate this last point, because as you know, many people try to avoid the emergency department and don't tend to seek care there unless they have an acute concern. And so this to me is a concerning finding, because young adult males may not be seeking care even when they have a concern. And that's again because of all of those restrictive masculinity as well as the socio-ecological framework at play affecting that one decision to seek care. And I just want to say thank you to everyone who has continued to make excellent comments in the chat box. The other flip side to this is it's not all about the young adult males. Again, thinking of the socio-ecological framework, I want us to think about what about healthcare providers and the public health community's role in engaging young adult males. And I would again invite you to share in the chat box what you think we should be doing to engage young men. I love it. Ask them, open-minded and training about the culture of young adult males in order to have dynamic and connecting conversations, more inclusive resources, initiating the conversation about their health and not waiting for young men to initiate. Ask them how they're doing. Changing our language and being inclusive of men. Absolutely. So thank you all for sharing. Clinical tools, absolutely. So thinking about our healthcare system first in terms of that, I want you to envision this little girl and she's going to the pediatrician's office or her healthcare provider's office, and she sees her healthcare provider regularly for her annual visits. And then she transitions and becomes a young adult. And she has a pretty clear transition where many young adult females feel connected or a need to see an obstetrician or gynecologist, or hopefully another primary care provider who can take their needs. But young adult males don't necessarily have this clear transition point. I also want you to take a moment now to just reflect on what that clinic, whether it's a family planning clinic or a primary care provider's clinic, may look like, and whether it's engaging young males, not engaging young males, or kind of ambivalent to young males. Yeah, I love these comments. Acknowledge our exclusion of them historically, and teach providers and public health professionals about this history for sure, and developing marketing materials, absolutely. As Dr. Weatherton demonstrated earlier, you know, a lot of the marketing materials really focus on restrictive masculinity and aren't necessarily about healthy masculinity or living healthy for young males. So with that, clinics typically aren't male friendly, and what then happens is that as males transition from adolescence to adulthood, they become more disengaged in care. They also can often be reprimanded, unfortunately, for their negative behaviors. And there's been research showing that some feel blamed for getting a female partner pregnant, or maybe blamed for their substance use. And as you can imagine, when you're being reprimanded, it doesn't necessarily foster a healthy relationship nor a desire to engage in care. And so this then becomes a really vicious cycle where males become disengaged in care. Care then is not including them, and it continues and continues. And then public health policies aren't incorporating them, and research is lacking on young adult males because we just don't have them accessing health in the same way. So what can we do as a healthcare system when we're seeing a young adolescent male, and to ensure that he transitions to becoming a young adult male who's really engaged in his health? We can make sure to talk about the importance of routine health care. We can also make sure to let them know that sexual health is more than just birth control. To discuss mental health and to normalize how many young adult males struggle with their mental health, and that it's okay to seek help and that we're here to support them. And also letting them know that we're there should they have an acute health concern come up, and how to access care if that were to happen. The other piece, just from a bigger public health perspective, is to really think outside of the box, or think outside of the man box, and focus on making care and health equitable, including our young adult males, making sure that they're accessible, both from a cost and insurance perspective for young adults, which the Affordable Care Act has definitely helped, but there's still plenty of room to improve. Consider making it accessible in terms of all of the access points, whether it's in clinics or schools, community programs, sports programs, such as the Coaching Boys into Men, or barber shops even, or online. Making sure that the interventions are acceptable to young adult males, and making sure that they're appropriate. So recognizing that health isn't just merely the absence of disease, but really about the physical, mental, and social well-being of young adult males, and making sure it's effective. So going through PDSA cycles and making sure that we're keeping what works and adjusting what doesn't. The other big piece about thinking outside of the box is really focusing on an empowerment approach and a strengths-based approach. As Dr. Weatherton mentioned, really empowering young men to engage in their health care. And then lastly, I just want to take a couple of minutes to talk about an online approach that we have developed here at Boston Children's. It's our youngmenshealthsite.org. This is a copy, a screenshot of our homepage, and from this week, and as you can see, we have the coronavirus banner for anyone who has questions about that. And then we have different subheadings for general health, sexual health, emotional health, as well as Ask Us and Health guides. And the division created this website back in 1999 as an adolescent health website, and then in the 2000s it was divvied up into a young women's health site and a young men's health site.org. And we thankfully have funding through our division, as well as several grants to help support it. Our website has over 300,000 visits per month, and it serves an international audience. And we have health guides, and that can be really helpful because we essentially circumvent a lot of the restrictive masculinity concerns by having it be anonymous. And so young adult males who are engaging with our website don't have to worry about what their peers may say or others may say, or stigma they may face by going to a family planning clinic and then people automatically assuming that they have an STI. And in the health guides, we also offer tips on how to bring up their concerns to their healthcare provider, focusing on that health literacy piece that Noah was mentioning earlier. We also have Ask Us questions, which are anonymous questions that adolescents and young adult males can submit. And just as a little bit of guidance here, this is an example of 2 of the most recent Ask Us questions. We answer 1 to 2 a week, and many of them are related to sexual health. We've been noticing with coronavirus, there's more and more questions about mental health, including sleep disturbances or feeling anxious and what to do. And so with that, here are a few references for my slides, and thank you for your attention. This is my contact information. Happy to talk about any adolescent and young adult health topic, but especially around young adult males. Would be happy to connect with anyone one-on-one. And now I'm going to transfer the presentation back to Dr. Weatherton.
Thank you, Dr. Vargas. So if you want to keep your screen sharing, that could work just fine. Might be a little smoother. Is that good?
Perfect.
Okay, great. For our last chat box, we really just want to open up the discussion around the new normal of COVID-19 and social distancing. And so as healthcare providers and community members, what are you all concerned about for young men's health in the current situation? And again, just thank you everybody for all of your participation. It's been great to see how involved everybody has been.
Dr. Vargas and Dr. Weatherton, this is Lynn. While we're waiting for a couple other questions in the chat box, I thought I might ask if either of you have seen a difference in young men's willingness to engage in telehealth services now that some of that has become more accessible, either mental health or physical health. I wonder if you had any seen any change in that.
So this is Dr. Vargas. I'm happy to talk. So I think a lot of our young adult males are enjoying the telehealth visit. It limits some barriers and some stigma with it. But I think because, as Dr. Weatherton mentioned, they're so used to screen time right now, I actually find that they're being more candid with me during our visits, because they're in their comfort of their bedroom or of their home, and I've really appreciated it, actually.
Yeah, I can see that. Yeah, that's been my impression as well, is that for all adolescents and young adults that have kind of been going through this with other adolescent healthcare providers that are my colleagues, I've been able to see that too. It kind of breaks down that nervousness that gets built up in going to the clinic, and they can just lay in bed and talk to you in the comfort of their own space. So we are seeing a couple really good responses as far as concerns about young men's health given the current situation. So concern about increase in anxiety and depression, declining social engagement, and especially being in homes that are maybe abusive or neglectful or otherwise stressful, unsupportive family members that reinforce restrictive masculinity. Some households may influence the man box, and this person's asking, what are some strategies to make sure we educate the family as well about improving male health? And then another concern is increased porn usage, concern about the decrease in motivation, and decrease in them caring about positive influences, and just overall decreased social engagement and physical activity. And I think there's there's a lot of other ones. I'm just reading through it very quickly, but not enough groups or health organizations that are geared primarily towards men. So yeah, that might be just in general. And yeah, so in the negative circumstances that can rise from the vacuum that is created when positive experiences are restricted. Sure, so that kind of encompasses everything, is that it's easier maybe for negative health behaviors to come out when those positive experiences aren't allowed. You're not allowed to leave your house. So I really appreciate you all putting in your thoughts about this. And then we'll kind of ask the converse question, which is, what are some ideas that we can come up with to combat these negative health outcomes or increase risk of negative behaviors? So I see get spokespersons that can reach them, relatable and relevant Instagram content, yeah, and public health initiatives for outreach. So I think those go hand in hand kind of with what we were discussing earlier as far as reaching them where they're at. So finding the spaces that they're in the digital landscape and putting our messaging out there. And then educating families, strategies for gaining life experiences while restrictions are in place, and on social media. So yeah, we can't just target our messages at young men, but it has to be the communities and the support systems that surround them. Absolutely. And just wait another second in case anybody else wants to chime in. These are all great ideas to kind of come up with a way forward through difficult circumstances. Great. Great. So I think we can go to the next slide. And this is just kind of echoing a lot of what you all have already said. Take a look here. I'd like to raise a few points about the new circumstances that young men are living in. We know there's been a huge loss of structure in their lives, with school moving to online for many of them. And with this, they've lost much of their peer contact, their physical contact and physical interaction they have, and as well as increased risk of substance use and risky behaviors that many people mentioned. One thing I thought was interesting from a recent article I read was poorer grades due to difficulty collaborating with peers that you would otherwise be working together on homework or on a project together. And so that's something that is important to keep in mind. But young men are starting from a deficit as far as connectivity. And that means it can be harder for them to maintain those connections in isolation, just echoing what a lot of you have already said. And so they're more likely to engage in risky behavior because of boredom, because they want to get out of the house and stretch their legs and do those developmental things that they're not being allowed to do. And so this may be a concern for non-adherence to social distancing precautions, and also the use of protective masks. One positive way of reframing the situation, and I do just want to say, I appreciate the one comment about LGBTQ, adolescents and young adults stuck at home with unsupportive family. I think that we have to keep that in mind in thinking about the ways that school can be not just a support structure, but a way to feel seen fully as a person, as the person that you are. And so to put a positive spin on it, we can reframe the circumstances to see that there's an opportunity for men to be more vulnerable, since so many of them are in isolation and so many of us are in isolation. So it may be easier for them to open up. Like Dr. Vargas said, and everybody knows that we're in similar circumstances as far as being stuck at home, not being able to meet with our friends. And so it's important for us to seize this opportunity if we can. And then next slide, I just wanted to highlight some more resources. So Dr. Vargas talked already about the Young Men's Health site, which I think is at this point in this population is really the gold standard for where not just young men and their support systems go, but also where clinicians go. So it's been a great resource for many years. I will also plug the Partnership for Male Youth website, which has clinical toolkits for clinicians, as well as fast facts, kind of easy one-page sheets on eating disorders or mental health or substance use and that kind of thing. So it's easily, again, that like more easily digestible content. And then clinical guidelines and curricula. We talked earlier about the Manhood 2.0 curriculum that is based on Promundo's work around the world, and then the APA guidelines for working with boys and young men. And it's for psychological practice, but we know that that bleeds into physical health and community health as well. And as far as books, there's a running list of book recommendations on the Columbia School of Public Health Young Men's website that I helped set up. And it's something that I keep kind of as a running list for recommendations or books that I find are really important to me on this topic. And so that's something to keep in mind as well. That'll be linked in the PowerPoint afterwards. And then also another set of resources to listen to. There's a number of good podcasts, Breaking the Boy Code and Modern Man. And then if you're familiar with the NPR show Hidden Brain, there's a really powerful episode called The Lonely American Man, as well as a few other ones that provide context specifically for young men. And then to watch, I would definitely recommend The Mask You Live In as a documentary that kind of touches on this subject and is really powerful as well. Next slide. All right, well, thank you all so much. And if there's any questions, please just put them into the chat box. I think, Dr. Vargas, there might be a question for you already, but feel free to reach out or contact me as well. Thank you all so much for coming and for your participation.
So just to respond to the question, as of right now, the Young Men's Health site does not offer a specific chat room around mental health, but that is something that we are looking into. So thank you.
We have just a few minutes left before the hour is over, and I want to take the opportunity to thank Dr. Weatherton and Dr. Vargas so much for their presentation. It was incredibly thought-provoking, and you provided so many valuable resources. There's just a wealth of information in your slides, and so we're grateful. Please feel free to type any questions that you have, any final questions that you might have into the chat box. Like I said, we have just a few minutes, and we can answer some questions before the hour is over. I did want to point out our website, where you can also find some additional resources and also some links to the previous webinars that we provided on young adult health. One thing that stood out for me today in your presentation was that similarly to the discussion we had about mental health in general last month, was that perhaps this opportunity, unfortunately, of the pandemic and how we're all finding ourselves much more isolated, that perhaps an unintended benefit is that it is raising this issue of mental health and forcing the conversation. And so, as Dr. Weatherton and Dr. Vargas said, that maybe this is an opportunity to talk about this with young men in a way that we haven't been able to access that conversation. It might normalize it for them, gives them an opportunity. So I appreciate you bringing up that point very much. So what we see on the screen now is a link to the National Network of State Adolescent Health Coordinators website. And you can see here, it points out where we have links to several tools, including a link about young adults and maternal and child health. So you can find resources about those and many other topics related to adolescent health in general, links to these webinars, and the corresponding resources and speakers that we had on the previous webinars. So you can find that there. You can certainly follow up with me at the State Adolescent Health Resource Center. You can find my contact information on this website. And like Dr. Vargas and Dr. Weatherton said, they'd be happy to respond to questions if you would like further resources or to continue the conversation. So not seeing any other questions in the chat box, I just wanted to thank you all for joining us today, and thank you for your time, and to just say one final thank you to our presenters today. We're so grateful that you were able to share your time and expertise, and wishing you all health and wellness as you go on throughout your day and the rest of your month. So thanks for joining us today.